Hey everybody, wanted to chat a little bit about a treatment that I do for pain. It's called battlefield acupuncture, and it is actually acupuncture that's in the ear. Fancy name for that is auricular acupuncture. And you can do auricular acupuncture for a variety of complaints or concerns, body areas, etc. But the acupuncture portion that I've been trained in for the ear is for treating pain in general. So I've used this to treat headaches, any kind of joint pain from arthritis, whether it's neck, back, hip, knees, any of those. I have attempted it for pains that are related to nerve, like a fibromyalgia, and haven't had much success with that. So I typically only do those for more musculoskeletal type pains, and then headache is the one that's a little bit outside of that I have had good benefit with as well. So the acupuncture is a little bit different. Oftentimes the first thing people think of when I say that I'm going to do acupuncture in their ears is that they're going to have these long needles sticking out. And you could technically use the long acupuncture needles for this, but the type of needles that I am using are actually semi-permanent. So this means that instead of just being in place for 15 minutes, like with a typical acupuncture, and then coming out, they're going to stay in until they fall out themselves. For most people, this starts to happen after a couple of days. Most people, by the time they get to a week, they don't have any needles left. I very occasionally have had some people with needles staying in almost 2 weeks. Usually don't recommend that just because it can cause some irritation, but they do just fall out themselves. So the needles are very tiny, and I'm not going to pull one out of the package, but just try and show you one here. Get it into focus. Maybe that will help. There we go. So it's, if you can see the little gold, it's that little gold part. The white here, that's all just the applicator for placing it. But the needle itself is just tiny, as you can see, because I can't even hardly get it in focus. There is a little sort of stud to it. So a lot of times we joke when we're placing the needles that we're putting their bling in. They are gold plated, so that lends to low allergic response. Some people are allergic to gold. I think in my times of doing it, I've had 2 people have allergic reactions to the gold, in which case we just pull the needles out. So there's 5 spots that we can place the needles in for pain in general in each ear, and I've got a picture here so you can see where those 5 spots are. So most of them are in the more cartilage areas of the ear. That does make it a bit uncomfortable when they're getting placed. Some people say as bad as an ear piercing, some people say not as bad. I think it just depends on the person and their pain tolerance. But that usually is just brief, right? While I'm placing it, and then that pain goes away. The ears can be warm and tingly for about a half an hour or so after the needles are placed, and then it calms down. If you bump the needles, you do get another little jolt or a zing. I say that's okay though. You're just reactivating that spot, so maybe it'll work even better. A lot of people will have decreased pain right after the needles are placed. Some people don't really notice the benefit until the next day. I have had some patients after their first treatment not feel a great response, but then they want to go ahead and try a second one just to see, and we do, and they notice benefit after the needles are used a second time. We can do the treatments every 2 weeks. A lot of people will just kind of do it once a month. I often find the more we do the treatments, the benefit tends to kind of stack and last longer. So a lot of times people are having benefit the first couple or few days after the needles are placed while they're all still in place. But then with repeat treatments, they start to notice the benefit is lasting. Even after all of the needles fall out, they're still feeling that pain relief, which is great. Some of the side effects that can happen, a lot of times people don't really feel anything, right? There's no side effects, but some folks may feel a little bit dizzy or lightheaded, feel a little euphoric, sometimes nausea. I've never had anybody vomit, but that's something that could potentially happen. Most people do really well, and besides the 2 that I had that kind of had allergic reactions, most people don't really have any side effects at all. If you feel that you're not having a good response, and sometimes pain can flare a little bit shortly after the needles are placed, like that same day, if that doesn't seem to get better, or if you feel that there's irritation, the ears are reacting, then we just want to pull them out, which, as you can imagine, could be a little unpleasant. There can be some discomfort and maybe even some bleeding with that. It can bleed a little bit when the needles are placed. It's usually very minor. Even if patients are on blood thinners, I haven't had people bleed a ton. The only types of people that we wouldn't want to place these in was if you had a known allergy to gold. We wouldn't do that. Also pregnant patients, we wouldn't place these in pregnancy just because there are areas in the ear that could be stimulated that could cause uterine contractions, and we wouldn't want to do that if a person is pregnant. So those would be kind of the only cases where we wouldn't want to do this. And we also wouldn't want to continue to do it if it wasn't having benefit. 80% of people do have benefit, but 20%, which is still a fair chunk, don't really feel any benefit with the treatment, in which case, we might do it a second time, like I said, just to make sure. But if we're not having any benefit after that, we would not continue treatment, because that would be a waste of your time and mine. And we don't want to do that. So that's a little bit about battlefield acupuncture and some of the things that I use it for. And if you think you have something that you would like to try doing battlefield acupuncture, we certainly can. It is covered under the Crossroads Primary Care membership, but I also can do it for folks if they are just wanting to have it done, but they don't see me for primary care. So don't hesitate to give me a call, or you could go on the website and fill out a form there, just asking questions, maybe letting me know what condition you had that you wanted treated, and we could talk a little bit further about that. Okay. All right. I hope you all have a great day.